This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Regina League.
Hello, everybody, and welcome to another broadcast of the Good Neighbor Podcast here in South Charlotte. I'm excited to bring back Dr. Kyle Jones. He is the clinical physician at Carolina's Chiropractic and Spinal Rehab. Good morning, Dr. Jones. How are you?
Good morning, Regina. Thanks for having me.
Absolutely. So not only are we buddies, but I'm also a patient, and that's how we found one another. And I know today's topic is something I've got a lot of questions on. But first, I want to congratulate you guys. You have won Charlotte's Best Chiropractic Team. Is it 4 or 5 years in a row?
Well, different awards, but this year was the full Charlotte with the Charlotte Observer, and we're very proud of that. Very thankful our patients are willing to support us and continue to let people know the care that we provide.
Well, you guys really are the best of the best. You have 2 offices, Waxhaw and Pineville, and I just signed up for a series of your VitaBed and did a session yesterday. So let's talk a little bit about that, your passion, your mission with your business.
Yeah. Standard chiropractic physician, been doing it for 17 years, musculoskeletal based, evidence based. So we did a lot of spinal rehab, working with disc issues, preventing people from having to undergo injections and surgery and utilize medication, just getting them back on their feet from a functional perspective. And so over the years, my practice didn't start with all the equipment that we have now. I started with just a single flat bench adjusting table, the old school lay you on your side, adjust you type of thing. And I started to quickly realize the limitations of that. Not that it's not effective, but it's a one-trick pony, right? It can't fix everything. So I started adding other equipment, flexion distraction tables, axial decompression tables, to just really give the body a better chance of healing. And then about 2014, I stumbled into what's called the Class 4 laser. And it was a newer technology, not a ton of research about it, but it's the use of light in a specific manner to stimulate the body to help basically accelerate the healing process, reduce inflammation, reduce pain. And there's no side effect to it, which is incredible. So then as technology has advanced, I saw comparing my practice without it versus my practice with it. And I saw the fascinating results of how much faster people healed with the use of laser therapy. And this is not with medication, not with surgery, right? It's just with the application of a laser light to the injury site. And so then technology continued to advance, and they developed these full body beds that utilize LED lights versus lasers. And now we have this huge body of evidence of what use of light does to the systemic overall health of the human body. And it's just been fascinating. We've been doing it about a year. We have one in both offices. I do it myself. I've done it twice a week, every week for the last year. And I just can't tell you the differences of what I feel from just an overall energy focus, just a well-being standpoint.
What's so funny, when I first heard about, prior to doing it myself, I was thinking, oh, this is just for the elite athletes, and this isn't something that'll ever make it down to the normal person. So it's really exciting. And I guess my take is it's kind of healing you from the inside out. Is that a little bit of what it does?
It is. That's exactly right. And to reiterate your point of the professional athletes, when we're into a newer technology and something that may be working to help basically optimize the human function, you've got to look at professional athletes and the ultra rich. They get it first, right? Because they have the access, they have the money, they're interacting with the highest quality of providers it may be. And so to your point, whenever I first started looking into the full body light beds, one of the few places in the state of North Carolina that had one of these types of beds were the Carolina Panthers. And so, those are the ones that there's so much invested in the health of their players because that is their asset, right? And so, but to answer your question, it is healing the body from the inside out. And if you go all the way back to, the evolution of the human body, is that basically our cells have photoreceptors on them. And so what we've been able to do is isolate certain wavelengths of light, the ones that are beneficial, not the UV, because the UV is beneficial, but at a certain dose, it can become detrimental. We know that. And so these beds have removed the ionizing radiation of the UV light and focused on the other wavelengths. And that's how you get the therapeutic benefit without the side effect. So basically, there's different depths of penetration for the different wavelengths, and it can stimulate cells in different capacities. But the biggest thing with it is what we know, and a lot of people know what mitochondria of the cell is. It's the powerhouse of the cell. But the mitochondria takes up the light in each individual cell, and it makes the mitochondrial function better. And so ultimately, if your cells are able to function better and increase the amount of energy they're producing, then ultimately the cells can heal. And if cells heal, tissues heal. And if tissues heal, the body functions better. Does that make sense?
It does, and it's very complex. I know when I went in for my session, there was different levels, and there's autoimmune, I believe. Tell me what those different levels are.
So we have pain, inflammation, rejuvenation, wellness, mood improvement, sports recovery. And so, this is the difference between medical grade and just something you can buy off of Amazon. All right. And I'm not saying that medical grade equipment is the right thing for everybody. Obviously, there's a cost for that. There's the logistics of getting to an office type of thing. So the home units are beneficial, but they're just not you can't compare them. They're not apples to apples, right? And so, our office, we do have doctor supervised, and then also, you have the technology that's built into the machines. And the cool thing about the company that we use, they've done the research on how to apply these protocols. And if you remember when you're in there, some of the phases of the treatment session actually cycle on and off. You'll get flashes of light.
Kind of tripped me out. I was like, ooh.
Yeah, it's first time you experience, you're like, whoa, what's going on? But the flashing of the lights is actually cycling on and off so that your body gets a break. But then also the acousticness of the cycle will drive the light further into your body. And so, again, this is all technology that's been experimented with, and there's scientific studies behind it. And we're just trying to apply it in the best manner to give you the most therapeutic benefit.
Yeah, so for our listeners, I'm going to give them a visual. It resembles a tanning bed, but you don't get warm. The room is nice and comfy, and you just take everything off but your underwear, I believe, because you want the skin to contact. You pull it down, and you just lay there. I think my session was 15 minutes, but I wanted all of those buttons, so I think they selected the top one. Is that for pain?
I think you probably chose pain relief. Yep. And it's a little more intense than the other ones. And, we encourage people to try multiple different ones because everybody's body is slightly different. Then you're going to get more therapeutic benefit from one versus the other. And sometimes people say they jump out, and I had one lady tell me that they feel like Mario back in the Super Mario Bros. Whenever he would get a mushroom, and he just felt like, she was growing. And then other people feel real rested and calm. And it basically just puts your body in a spot where it's back to homeostasis, but in a balance. So if you're too high, it'll bring you down a little. If you're too low, it'll energize you. And, that's what we're seeing with it.
Well, I think you and I were talking ahead of time, the time of day as you get into doing this, because I'm going to take the guidance to do it twice a week for my series. Is it better to do it in the morning to start your day? Is it better to do it towards the end of your day? So what's your philosophy on that?
Yeah, and I've now had the time to experiment with it personally to see what I get the most benefit from. We definitely know that the therapeutic range is somewhere around 3 to 5 days. So that's why we do recommend twice a week if you're truly trying to stay in that optimal function, world where your body's just doing what it's supposed to. And then from a morning to an evening during the day, I think you're going to get, now we're getting into the real extreme of the benefit. The 90% is just getting in the bed. The extra 10% is maybe a time of the day type of thing. But there's a lot of information out there about the sunrise first light in the morning and what it does to the human body and the stimulation of the neural pathway into the brain and the production of melatonin in the pineal gland in the brain. And so people that struggle with sleep, going to sleep and staying asleep, the morning would be by far the best because it restarts that sleep-wake cycle, if that makes sense. And that's what the sun actually does. And then the sunset will cause the pineal gland to release melatonin to try to get you sleepy and to get you to go to bed. So, early in the day, late in the day may be the most beneficial with the wavelengths of light. And so that's where I'm starting to lean, because I've seen my own personal benefit from it.
Interesting. And you've been doing this personally, you said, for a year?
Yeah, we got our first bed in February of last year. And so I've been doing it twice a week religiously for the entire year. It's one piece of my puzzle. I'm not telling you that this is the end all be all. I'm very into, personal health and things like that. But I will tell you that this, in combination with my diet, my exercise, it absolutely has given me a different feeling at this stage of the game.
I'm super excited. I'm really, really excited that you guys introduced me to this. Well, it has been awesome chatting with you today. Again, you have your 2 offices. One is in Waxhaw, one is in Pineville, and it is Carolina's Chiropractic and Spinal Rehab. Is there anything else you want to add today, Dr. Jones?
No, I mean, just the biggest thing is there are many ways to heal the human body, and it doesn't have to be with the alternative chemistry through medication. There's tons of research out there about these types of things. And I think you're going to continue to hear a lot more about red light therapy and photobiomodulation and the benefits that are out there for it.
Very, very exciting. Wonderful having you on the show again today. Look forward to our next one.
Thanks for having me.
Thank you for listening to the Good Neighbor Podcast. To nominate your favorite local businesses to be featured on the show, go to gnpsouthcharlotte.com. That's gnpsouthcharlotte.com, or call 980-351-5719.